Hello, my name is Dr. Saeed Junaid. I'm a consultant radiologist and I'll be discussing with you steroid injections. At Acorn Ultrasound, we are very fortunate to have highly experienced and nationally recognized experts who perform a large volume of ultrasound-guided procedures. The great advantage of using ultrasound to perform the steroid injection is that we can precisely deliver the steroid into a very specific location with very high accuracy, something which is not always possible if we do not use ultrasound. So why would you need a steroid injection? Steroids help to reduce inflammation, which then can help in reducing pain and improve rehabilitation. They work by dampening down the local inflammatory response, and so if you have an inflamed tendon or a ligament, injecting steroid around it can then help reduce the pain and also help with the rehabilitation. Also, patients who have arthritic joints, for example, knee arthritis or osteoarthritis of the hip, having a steroid injection can again help reduce that inflammation and reduce the pain and allowing for more pain-free motion of that joint. So when can you start feeling the benefits of the steroid injection? It takes 1 to 2 weeks for the steroid to start bringing its action into the area. You may receive some local anesthetic in the beginning of the procedure, which may only last for a few hours. So the actual effect of the steroid will really start showing its benefit in about 1 to 2 weeks after the injection. How long can you expect the benefits to last? Well, that really depends on the reason for your injection. If you are having an injection for a severely arthritic joint, then it will really buy you time for a few months. For some people, the effects start to wane off in about 4 months. It can be a little bit sooner than that. In other patients, they only need the one odd steroid injection, and that really helps their rehabilitation, and that area of the joint becomes pain-free afterwards, and they no longer need any further injections. What can be injected? Essentially, there are hundreds of potential targets for us to inject, and they effectively include the joints, the ligaments, muscles and tendons, as well as the nerves, which can be a focal area of pain. And in terms of joints, the common joints that we inject include the shoulder, elbow, wrist, hands, hips, knees, ankles, and feet. And even the small joints within the feet are very, very good targets for injection, especially if they're very tender. Steroid injections are pretty low-risk procedures, and depending on what specific area you have injected will then determine what specific risks you have of that. But generally speaking, there's a risk of pain, which can be particularly more so day 3, day 4. There's a small risk of infection because we are introducing a needle from the outside world into the body. Again, very small risk. Risk of bleeding and bruising. Allergic reaction. Most people don't tend to have allergic reaction because in fact we use steroids to reduce allergies. Again, the risk of damaging surrounding structures, that will determine what sort of injection you have. It may be the surrounding tendon, it may be the actual ligament near it, which can potentially get damaged. Some patients can also get skin depigmentation, particularly patients with darker skin, where the steroid leaks into the skin, and it can cause an area of depigmentation. This skin depigmentation is not permanent, and it will resolve after a few months, and it's usually never an issue. But again, you should be aware of that. Patients who are diabetic, the steroid can increase your blood sugar temporarily, so you should be aware of that if you feel that your blood sugar has increased. Sometimes an injection we do does not work. It may be because the inflammation is a lot more than the steroid can dampen, or it's not where the pain is coming from. So you may have an area of inflammation, but that's not necessarily giving you the pain. Also, numbness is something that can happen because we've given you some local anesthetic at the time of the procedure, and that's what you may be feeling. But again, the doctor will explain to you your specific risks associated with that procedure and any specific steps they need to take to reduce that. Most people are suitable for steroid injections providing that's the correct thing for them. However, if you have an area which is infected and we can't really inject in that until the infection resolves. If you're on blood thinning tablets such as warfarin, aspirin, clopidogrel, dabigatran, apixaban, etc., you need to let the doctor know. It does not mean that you can't have the injection. It's a conversation you need to have with the doctor, and we need to then balance the risk and benefit of that. If you've had previous allergic reaction, and most people don't have allergic reaction to the steroid, it's usually to the local anesthetic, so do let us know, and then again we may need to mitigate that procedure as well. If you're unwell, then you really need to get better first, i.e. if you've got a cough or a cold, if you're having a fever, that you need to get over that acute illness before you have the injection. If you do have injection in an area which is going to be surgically managed, so again, surgeons don't like to have steroid in an area before they operate, so again, please do let us know for that. It's not really an ideal thing for patients who are pregnant or breastfeeding, and also if you've got poorly controlled diabetes, because the steroid will increase your blood sugar levels. So during the procedure itself, the procedure is a sterile aseptic procedure, so we'll clean the skin, we'll have an entire aseptic area, and we'll use local anesthetic to make sure that the patient does not feel too much discomfort during the procedure. After the procedure, we may ask you to take a seat in the waiting area for a few minutes, and once you're feeling comfortable and ready to go home, we recommend that you get somebody else to get you home. Try not to drive on the way, because it may invalidate your insurance, because the local anesthetic that we've injected can make driving a little bit more difficult. Take it easy, keep that area dry, don't get it wet, no swimming for a day or two, because we don't want any infections traveling back into that tract that we've temporarily made from that injection. And you may need to take some simple painkillers if it becomes a little bit sore. For more information, please check our website on this link below, and we've got a much more detailed article on steroid injections and what's involved, so please check it out. We hope you found this video useful. If you have any further questions, please do get in touch with us, email us, or visit our website acornultrasound.co.uk. Thank you very much and take care.